Welcome everybody to our IDRPP Autism ECHO. We're thrilled to have you here with us today as we kick off our new year-long series around autism. We are recording today's session, so if you're joining that, you're participating and consenting to be recorded. We store these recordings on our Canvas page as well as our YouTube channel. You are free to go back and review them, share them with colleagues and families. It's a great way to just solidify that information. An ECHO session consists of professional networking, a didactic conversation or a speaker, as well as a case presentation. And that is one of my favorite parts of an ECHO because we get to hear from everybody on the call all the amazing things and resources that each of us have and bring to the conversation. We love having participation. So if you have questions or comments, if you will put them into chat, Colin Kingsbury, one of our hub members, will be monitoring that for us and get those answered for you throughout today's session. We love to have your cameras on so that we can see each other in this virtual world. And again, if you're interested in doing a case narrative, please reach out to Autism ECHO at aggies.usu.edu and we will get you set up on the schedule. Every time I move my cursor, it moves, so I can't forward my screen. We do talk about sensitive topics, so please remember to avoid any identifiable information, first, middle, last name, their addresses. If you have any questions, please reach out to a hub member. They all have an asterisk and the picture behind them, so they're easy to recognize. And I just want to send out a huge thank you to all the hub members. They help us find presenters as well as provide feedback about the curriculum. So thank you to all of them. Throughout today's session, Tori will be dropping a survey into chat. The survey is how we send out the credit for attendance. We really thank you all for completing those surveys. There is a question on the survey that asks for your address and contact information. That is for us to send out thank you information or thank you gifts, swag for completing that survey. The survey is what we turn into our funders to show the impact that these sessions are having for all of us on the call. We store everything on a Canvas platform, so if you are interested in accessing Canvas, where we store the recommendations, the recording, the PowerPoints, all of that information, just email autismecho@aggies.usu.edu and we will get you set up for that. Just another plug for those case studies, case narratives, case discussions, whatever makes it seem like it's not as scary. It's a great way to, one, get feedback from all of your amazing colleagues on the call, but also sometimes it's a great way to just go, oh, what I'm doing, I'm actually doing correctly. And sometimes in the work that we do, that becomes helpful to hear that. So if you're interested in presenting a case, just reach out to us. We do have social media where we share resources, we share information about upcoming sessions across all of our ECHO networks here at the IDRPP. So take a minute and follow us. And then I'm going to stop sharing for a minute and pull up my next slide. I promise that I am not always the person who talks. I just today get to be the lucky one to introduce our topic today, as well as talk about our case presentation. So bear with me for one moment as I pull up my other slides. Did my slideshow change, Tori?
Yes, it did.
Okay, great. So, welcome, and I'm thrilled to be kicking off our Autism Echo series for this year. My name is Janel Preston, and I am the CDC's Actorly Ambassador for Utah. I have the privilege of talking to you today about family engaged developmental monitoring and how that supports early identification through 5 key steps. Before we get started, I want to share a quick disclosure. I do get a small stipend from CDC, and what this really helps me is to support the cost of printing and distributing the materials, and allowing us to integrate these materials and program into systems and getting those directly into the hands of families. I'm really grateful for the opportunity to make these resources more accessible. I hope that our goals today are to explore what family engaged developmental monitoring really means, discuss our roles as early childhood providers, interventionists, and administrators in promoting developmental monitoring, and understanding how developmental monitoring supports screening, assessments, and referrals. To ground our conversation today, I want to highlight the 4 domains of development that the Center of Disease Control and Prevention focuses on in the Learn the Signs Actorly materials. And that's cognitive, social, movement, and communication. These domains help us frame our observation and conversations with families. I always like to start off with those 4 domains because I know there's a lot of development that each of us look at in our everyday work. And so by identifying which domains of development we're talking about, just provides that basic and understanding and framework for us all. The CDC has a range of resources in both English and Spanish, as well as about 19 other languages to help families understand better what typical development is. These are tools that are part of a broader health initiative, which began back in 2011 with a focus on autism awareness. Over time, this initiative has expanded to include all developmental delays and disabilities by aiming to promote more healthy development for every child. The materials are aligned with every well child visit from ages 2 to 5 years, making them really easy to integrate into our everyday work. They really serve as conversation starters between families and providers, helping them to identify concerns early and celebrate milestones. Most importantly, what I love about them is that they empower families to engage in their child's development anywhere and anytime. I think it's really important to help families understand that because developmental disabilities are more common than many realize, yet they are not identified until children enter school. This delay can result in missed opportunities for early intervention, support that can make a huge difference in our child's development and the family's experience. Research does show that 1 in 4 children are at moderate to high risk for developmental, behavioral, or social emotional delays. When these challenges go unnoticed early on, gaps in development may widen, behaviors may escalate, and families often then face increasing difficulties navigating support systems. So by identifying these concerns early and connecting families to resources, we can help ensure that children have the best possible start and reduce those stress for caregivers along the way. According to CDC's Autism and Developmental Disability Monitoring Network, 1 in 31 children age 8 nationwide are estimated to have autism spectrum disorder. In Utah, the numbers are lower. 1 in 37 children age 8 are identified as having autism spectrum disorder, and 1 in 55 for 4-year-olds. So while we're making tremendous progress, we still have work to do in raising that awareness and in improving early identification, not just for autism, but for all developmental concerns. As we think about today's session, let's consider this family scenario. So it's a family of 3, almost 4. The child is 30 months old. They attend daycare 4 days a week. They've just moved to the area, so they have not found a doctor yet, but they are enrolled in daycare, and daycare is starting to be concerned about some of the child's development. But because he's just new, they're not really sure how to bring that up to parents. So think about that as we're talking today. How do you support, or how would you support this family and child? As we talk today, I'm going to be referring to this framework for early childhood development, and it's these 5 essential components. The first one is developmental promotion. The next is family engaged developmental monitoring, developmental screening, referral for needed supports and services, and then developmental evaluations and receipt of services. And while these components don't always occur in a linear order, each one plays a vital role in supporting children and families. For example, developmental promotion really involves educating families, the community, and everyone about what typical development looks like. If I was a parent and my first child might have been a little slow to meet milestones, I might not be concerned about delays in my second child because that becomes my norm. We need to help them understand what is typical development. We need to also talk about development in general, just that basic understanding and identification. It's more than just checking their height, weight, and head circumference at their pediatrician's visit. We need to promote healthy development so that we can help families, caregivers, and communities recognize what's within the norm and what needs further attention. The next component I'm going to be talking about is something that I really feel like is one of the biggest things that as early intervention providers, we can work to strive to be better about, and that is that family engaged developmental monitoring. I can't tell you how many times I do these presentations or I go into community settings with providers, healthcare professionals, and they say, I do that. I complete the ASQ or the ASQSE. And that's great, and I do not want that to stop. But I want to also have that understanding that monitoring and screening are not the same. They really complement each other, but it serves a different and distinct purpose. Monitoring is ongoing and often informal, while screening is a structured process using a validated tool. Together, they really provide that more complete picture of a child's development and help us ensure that no child goes unnoticed. So thinking about the evolution of early identification, historically, what we really focused on was detecting developmental delays or disabilities. And while that's important, that approach often misses children who are vulnerable, but not yet showing clear signs of delay. So early identification should be a universal process, not limited to just children who are already showing those concerns. We need to engage all families regardless of background or risk level. Shifting that focus from just diagnosing to listening to families, allows us to better understand a child's development in context. Families really bring that unique insight that can guide more effective supports. When we prioritize families' needs and strengths, including access to social and concrete supports, we create a more holistic and equitable system. This approach leads us to better outcomes for children and really strengthens the family-provider partnership. Ask yourself, how are we evolving our practices to be more inclusive, proactive, and family-centered? The National Help Me Grow Center developed a roadmap to define and advance family engaged developmental monitoring. And one of the biggest challenges that we face in our early childhood systems is that lack of shared language. So remember when I was talking about screening and monitoring and how most of us think that they are the same, but they are very distinct things that serve a purpose. And so what does that mean? What does family engaged developmental monitoring actually mean? And how does it look like in practice? This roadmap that they have created really shows how it can be embedded into systems, and that it's not just asking parents how a child is doing. It's really thinking about that intentional partnership where families and providers combine their knowledge to understand a child's developmental path. It includes celebrating progress, identifying concerns, as well as having ongoing conversations that build trust and open the door for deeper support. They have a great checklist in this roadmap that talks about how I can monitor myself in seeing how I am engaging parents in this intentional partnership. I will share that roadmap as well as that checklist. It's a great self-reflection tool with that. I'm always deeply passionate about early identification as well as that family piece of it. That family engaged developmental monitoring is built on three essential attributes. It's one that it's inclusive, it's proactive, and it centers on the family's voice. Within my role in Part C early intervention, I often face the challenge of having very difficult conversations with families about their child's development and early identification of autism. So I get asked all the time, how do you have that conversation without upsetting families and cause them to shut down? And my answer is always the same, and that's trust. Trust is built by constantly affirming that the families are the expert on their child. Well, I may bring that knowledge of developmental milestones and early indicators of autism. I don't live their everyday world. I don't know their experiences. So by engaging families early and often in that process, these conversations shift from being confrontational to collaborative. As we reflect on some of our roles, let's ask ourselves, how do we engage families in meaningful ways? Are we creating space for their insights, concerns, and priorities? How do we use this approach to strengthen developmental screening, referrals, and ultimately improve outcomes for children? When families feel heard, respected, and involved, they are more likely to participate actively in their child's developmental journey. This is the foundation for early identification, timely support, and long-term success. I'd love to hear some of the things that you guys do to engage families in meaningful ways. If anybody's brave enough to come off mute or put it into chat. Okay, well, we'll keep going on it, and hopefully throughout this we can think about how are we engaging families in meaningful ways. Um, I love using Learn the Signs materials for many reasons, but mainly because they're free and accessible to everyone. In early childhood settings, we know that funding is often limited. So having this high quality, no cost resource can make a big difference. The materials really help increase family engaged developmental monitoring. And it really, one of the important aspects of it is that it promotes that common terminology between providers and families, as well as the community. When we all use that same language to describe developmental milestones and behaviors, it creates that clarity. Families start understanding what we're looking for and what it means when a milestone is not met. As I've mentioned before, developmental monitoring is that long-term process, not just a one-time conversation. By using these materials, I can help families recognize patterns over time. For example, if a child isn't demonstrating a skill 1 month or 3 months ago and still isn't doing it today, that may indicate that there's something outside that typical range, and it opens that door for meaningful conversations about that this might need further support. The tools really strengthen that families and it help them build those stronger networks. And the materials provide clear guidance of what to do when there's a concern. I also love it because they have open-ended questions that invite families to share their observations and experiences. Oftentimes, I just provide the checklist with families to say which one of these milestones stands out to you. Is there something that you would like to tell me about your child? Because let's be honest, parents love talking about their children, and they should, right? Whether their child are toddlers or like mine, young adults, I still want to talk about them. I still want to have people be excited about the milestones that my young adult children are going to. So, as toddlers, encouraging families to celebrate milestones with us fosters that trust and collaboration. So, it really helps guide those and normalizing those conversations about development. We need to help ensure that families and providers have equipment or tools that help us have these conversations and that we can address them effectively. The checklists really provide additional support between the screenings that routinely happen. So again, coming back to that family, how would you, or what would the steps what steps would you take to build trust and start addressing those concerns? So remember, this is the family that they've just started the daycare and the daycare wasn't quite sure what to do. So if you were in that situation, what steps would you take to build that trust? Amanda says, complete a routines-based interview at the beginning of services to get to know the family better. Other things, using parents' names regularly. Pointing out the positive and focusing on what the family is already doing for their child. Yeah, those are all really great ways to start building that trust and to have those conversations with families. I love it. I love this visual of early identification because it clearly illustrates that identification is not a one-time event. It's really that ongoing process that must happen frequently and consistently. And this is really especially true when identifying early indicators of autism. Because autism, in especially in part C, we are concerned about different behaviors. And so they're brought in because maybe they have a speech delay. By continuing to monitor that child's development, we can then bring up further concerns around autism. We know that screening happens. We all report that we're doing it. However, parents may not recall completing a screener, or they say things, I filled it out, but I really didn't know anything about it, or I never received the results. And it's not that families aren't informed, it's that they didn't realize that the conversation or comment was actually a review of the screener. So we just want to make sure that we're improving how we communicate these moments, clearly stating that the reason why we're making a referral is because we noticed information from that screener. And that's why that is being made. It also really makes this process a time to educate and empower families, again, coming back to that same terminology and why it becomes important to normalize those conversations about development. And it happens at every time, anytime, all the time. I love talking about just development. The, and that's what the research will show is that when we do developmental screening and monitoring together, they're more effective at identifying children who need intervention, as well as that the family then is more likely to go and get the referrals or the supports that we're recommending. When I understand it as a parent, I'm more likely to follow through with that process. Okay, we're going to do a true or false. So just we can put it into chat. So families know what to expect and what information to talk with providers about. True or false? False, false, getting lots of falses. Yeah, false. Families don't really know what to expect during those check-ins. I mean, I remember with my kids when I was going to their pediatrician's visit, I knew that their head, height, and weight circumference, that's what they were going to look at. But again, it really leads to that missed opportunities to talk about development, to be able for me as a parent to open up those conversations and share what I am concerned about with my child or what I think is going really well. The next one. So families, oh, well, this one, let's just say it's true since I clicked too quickly. Families know what is typical development looks like and what to expect from their child. Families do want to know. In fact, a recent survey showed that one of the top Google searches among new parents is child development and child milestones. So they want to know, they want to be informed, and they want to be involved in that process. Okay, I'll try to make sure I don't click through this one. It's sufficient to have families complete a screener with questions about development. True or false? False. Seeing lots of falses, great. Yeah, it's really just one part of the process. Families need to understand what that screener is assessing and what the results mean. Many parents are, like I've mentioned, are uncertain about whether they've completed a screener or what the outcome was. And so simply handing over a form is not enough. We need to interpret and discuss the results with families. So involving families in developmental monitoring makes tough conversations easier. What do you guys think? True or false? Yeah, true. I love it. Yeah, when families are engaged, they're more likely to notice those developmental patterns and feel prepared to discuss those concerns. They also, I love when a family has called for early intervention and they've started looking at their child's development. And then we go out and they're like, somebody brought this up. And now I've noticed that they aren't always turning to their name. Well, maybe I like being. Is there someone that came off mute and had a question? Okay. So they're starting to observe some of those same behaviors around development. How about this one? Most families complete developmental screeners during well-child visits. So I'm seeing some true, some false. And it's kind of a mixture of that, right? We think that we are doing a great job of screeners, and we really do, as providers, probably really do a great job with it. But again, only 34% of caregivers of children aged 9 to 5 years reported completing a developmental screener in the past year. So that means that 66% did not. Again, it just goes to show that when we are not engaging families in this process, they don't know that those conversations are happening, or that's what that question meant, or that's what my pediatrician or early child care provider was looking for. So by clarifying what that is and the purpose, it increases families' understanding of our process. So I'm going to spend some time talking about what is developmental monitoring. And developmental monitoring is really that ongoing process of observing how a child grows over time. It really is not a one-time event, and it needs to be happening regularly and systematically. It is a shared response. So we should all be doing it. Parents, grandparents, early child care providers, anybody who plays a role in the child's health and well-being contributes important observations and insights. Sometimes what I'm worried about as a mom, the grandma might not be as worried, or the grandma notices some other things that I am not worried about. So I think it's really important to involve everybody in that conversation. We need to start it at birth and continue throughout the child's development. It really helps, again, normalize those conversations and be able to catch concerns if they become more significant. We want to move past that wait and see approach. If there are concerns during the monitoring process, that should immediately immediately lead us to doing a developmental screener. That screener then leads to evaluations, and evaluations can lead to those supports and services. So regularly discussing this with families helps us recognize when delays are persistent and maybe outside that typical range. Just some key terms. So again, that common terminology. So developmental surveillance and monitoring are sometimes used interchangeably. Most of the time, developmental surveillance is talking about this in a medical setting or more of a clinical setting within that, as well as it's really focusing on professional observations and sometimes doesn't always take that family input into consideration. So the monitoring is what's typically used in community settings or early childhood environments. It helps us identify patterns and potential delays in development, but again, doesn't always include that family input. We may ask one or two questions, but it's more focused on our professional observations. And that's where I think that that family engaged developmental monitoring becomes critical, because it centers the family as those active partners as they're talking about development. It encourages that shared language, and while also recognizing their unique insights, that helps build that relationship between families and professionals. Screening and evaluations. So screening is again different than surveillance monitoring. Screening is the use of a standardized tool at specific ages to identify those potential delays. American Academy of Pediatrics recommends that they are administered at 9, 18, 24, and 30-month healthcare visits. Autism spectrum screenings are recommended at 18 and 24 months. Screenings are really a more complex thing that needs to be interpreted and shared by a professional. And then an evaluation is a more complex process that helps us identify where are those delays actually occurring and help us guide to better interventions. All of these tools or all of these steps are important in that early identification process. This is just another visual of the difference between developmental monitoring and developmental screening. So as they overlap, they're both looking for developmental milestones, and it helps us track those concerns. But again, each one is a different but unique process. So and need to be shared with families as we're talking about those. So thinking about Learn the Signs Act early, they really are tools to support those conversations. I think that anything that we utilize, we need to understand the strengths and limitations of those. So some of the strengths that I love about these materials to use with family engaged developmental monitoring is that it does encourage that open dialogue. They are ways They have really useful information to share with families. They support that next step of screening. They help families to know some tips and activities that they can utilize within to support that developmental growth. And I love it because it can decrease that wait and see approach. It helps families understand and be more active in that conversation, which again, I think really decreases that wait and see approach. If I had somebody telling me, well, yeah, that's a concern, but let's see how he does in 3 months. Or what happens when this occurs? As a parent, I can now say, no, I'm just really concerned, and this tool is telling me that I should be concerned, so I want to take it to that next step. I want to do a screening or move to an evaluation process. Again, there's limitations. And so as early childhood providers, we need to understand that these are not pre-screeners. They are not developmental screeners. They're really a communication tool that helps us make informed decisions, as well as helping the families come to the same page as we are. Screening is a great process that needs to happen, and I love that we are doing it. But we just need to make sure that we are engaging families in that conversation and identifying and letting them know that the screening is occurring. Encouraging them to monitor their child's development in between our visits, in between healthcare settings. I love when I go to a family's home and they're like, hey, Janelle, I did that screener. Not that screener, I did that checklist. And let me tell you this cool thing that's happening with my child now. I love to hear that when they're doing that. There's lots of great open-ended questions that families can answer, because as we all know, sometimes a checklist does not capture everything that's going on with that child or that family. And so it really opens that door to normalize those conversations, as well as provide more guidance about accessing different programs through that and resources that families can do. The milestones are representation of what 75% or more are doing by each age. And really it's intended to spark that discussion between families and providers. Here are some of the materials and some of the questions that I love, or ideas that I utilize. Some of these materials are is using them as a reminder of what our children are doing. I always thought I was going to always remember exactly when my children started walking or talking or doing those things. And so utilizing some of the materials is a great way to have that as a record keeping. And that I can then also ask further follow-up questions with them. So, oh, you noticed that your child is waved to some kids at the playground. So tell me a little bit more about how they react to other children or new adults. What one of these milestones stands out to you? Are you concerned about those? Have you ever completed a developmental screener? What does your pediatrician say? How is your child walking, running, or climbing? Again, it just starts having those conversations and normalizing those. How many of you have ever used some of the materials? You can put yes or no into the chat. Think about it. So yay, I love seeing that. Yes. So there's one comment in here that they have stopped printing some of them. And they have stopped printing some of them, but you might want to reach out to me. I probably have some of those. Again, that's what some of our stipend can go towards. but there is the electronic versions. They have a lot of those checklists electronically to be able to utilize with them. These are how we can continue to encourage developmental monitoring. The thing that I always encourage everybody to do is utilize the materials yourself and download the app. So as I've shared before, I have adult kids, but they are still my children that I track on my app. So sometimes I will get a notice that my child Coley needs to have a well child visit. And she saw that one time and said, Mom, I'm not 2 anymore. Why do you still do this? And I said, well, because you're kind of my monitoring child. I know your date of birth and I just subtract some ages for it. But then it also reminds me that I do need to schedule her yearly visit. So still is helping me, but becoming familiar with the materials so that you can confidently guide families through those conversations. Again, sharing resources. They have a great one for families around developmental concerns, Act Early, to guide families on what to do if they have concerns. Again, they just normalize those developmental conversations. Sharing those in the materials in your classrooms or clinic space is a way that we can increase that developmental promotion of materials. As I mentioned, these are when American Academy of Pediatric recommends surveillance, but concerns should prompt further screening at any point in time. I would love to get away from this wait and see approach because while we might be using it to give that time for that child to catch up, when do we stop? When does that concern initially be a concern? So instead of taking this wait and see approach, just take it to that next step, whether it is a screen or an assessment or a referral to any type of early intervention. I think that gets the families the supports and services that they need at an earlier age. Okay, so we're coming back to this family again. They've now been in our program for about 5 months. We've built up some trust with this family. We've been talking to them about development. We are starting to notice some new concerns so that the child is starting to use some rote phrases. They're struggling with those transitions. Consider how would you support the family and initiate a further conversation about this. We might want to talk about how they did developmental monitoring. We've used those screening tools and taking that to the next step with that. So we have really talked about that developmental promotion and family engaged developmental monitoring and screening. So now we're going to go to that next step about receiving the needed services. It really is that pivotal moment in early identification that families need to understand the services that are available to them, how to navigate that, and help them feel supported and empowered through the process. We know oftentimes that families are told, or especially is Part C, is that they need to have a diagnosis before they can access services. And that is not true. Families can access services and get free evaluations through Part C early intervention at any point in time. So I think that some of those barriers, such as that lack of information, cultural disconnects or logistical challenges prevent families from doing that. And our role as early interventionists, child care providers, whatever our role is that we want to make sure that we provide clear guidance, building some follow-up. So if I've talked to a family about seeking out further diagnostic evaluations, I don't want to not have that conversation in the next few months. I want to be able to say, hey, I recommended that you call this support. Did you follow up with that? And if they didn't, then I can brainstorm with that family, what were some of those barriers in order to get those services that they may need. We now have this family, and the family has received a diagnosis of autism. And again, that doesn't just end the conversation. How do we continue to help build a family support network and strengthen those relationships? Well, that might be considered a success because early identifications and supports really make that difference. We don't want to stop there. We want to continue to empower families by building trusting relationships, sharing knowledge, and advocating for those services. So we want to make sure that we create a culture where development is supported proactively, inclusively, and celebrated. We know that there are going to be some of those barriers. Developmental disability status intersects with key social determinants of health, and that can contribute to overall health outcomes for significant disparities of affected populations. While we're showing some progress in 8-year-olds of Black families being identified of autism at the same rate as whites, we know that Latinx families continue to be identified with lower rates. And what are some of those barriers that families of lower socioeconomic factors contribute to it? And sometimes there's just those systematic barriers. We need to make sure that we're understanding those disparities to provide all families family-centered care and listen and partner with them to support their overall development. So some key takeaways that I hope you guys all take away from this is that families are the expert on their children. They observe their child's development daily and offer insights that I may not see as a professional. That monitoring and screening must be ongoing and collaborative. They're not a one-time event and done, but they build that trust and communication, and that it's an ongoing process. So continuing to talk to families, use the materials like the milestone checklist and app in that conversation that we're having, and really normalizing those conversations. To just wrap up, that the materials and the toolkit can be found directly from CDC as well as from myself, and if you want to follow us on social media. So I'm going to stop sharing and I will open it up to any questions or comments. And if we have none, then we are going to just move right into our conversations. We don't have a case presentation. What we are going to have is just a conversation around what is some of the stigma surrounding autism. And Tori, I'm not sure who you've put into what group, so I'm going to let Tori just share that.
Is it okay if I just tell?
Yep.
rather than like share screen? Perfect. So Colin, in your group, I would like you to talk about the stigma surrounding autism, which is like a couple of questions in the first grouping. And then Joe or Joseph, I don't know which one you prefer. I would like you guys to talk about co-occurring conditions. And then Janelle, would you hop into that second breakout room?
Mhm.
And then Leo, I would love it if you would talk about conversations with families. And everyone should be assigned other than that. So I will start them right now. Welcome back, everybody. Janelle, would you like me to lead this section?
Yeah, that'd be great.
I just figured, since I was the only one outside of a breakout group, it might be best if you wanted to share something. Um, so I guess let's start with Colin and Stacy's group. I don't know who took notes, but whoever did, would you like to share something that you guys talked about or a couple of things that were really cool?
Yeah, I took notes here. So we had stigma and autism. So what are some common misconceptions about autism you've encountered? People with autism can't make eye contact. They don't have a social smile. Um, Obviously there's the differences between the male and female presentations of autism and how they have social interactions. And then some of the stigma there's people are still seeing is that people with autism can't be affectionate. And of course, all of those things are false. Um, so ways we can kind of challenge that stigma is to engage everybody to kind of open it up, talk a little bit more, educate parents about it not being anybody's fault. And then regarding language shaping it, use a strength-based approach as opposed to the deficit approach. Talk about all the things that they can do as opposed to the things that they can't do.
That's perfect. Thank you guys. Sounds like you guys had a really great conversation. So Joe and Janelle's group, would one of you guys like to share what you guys talked about?
I'm gonna guess Joe's gonna tell me since I took notes, I have to share.
Well, you do have everything, but we talked about the co occurrences of diagnosis and like how to handle those and how to help those kids that have multiple things going on. We talked about giving our professional opinion, but also staying within our scope of practice. And if it's beyond that, we share with those other professionals that they can go help with. But we also need to take into consideration the capability of parents being able to afford going and getting that help if applicable, and if depending on their insurances and that, getting tests done, as well as collaborating as best we can with those other professionals, so they're not coming in blind or not knowing what's going on, so they have a better picture before being thrown into this um, support system and growing it for the families to be able to succeed. Did I miss anything, Janelle?
Thank you guys. That sounds lovely. Um, Great conversation. Lastly, I guess Leo, it's up to you on group number 3. What'd you guys talk about?
We talked about a lot of really cool stuff, honestly. I think it was a really good conversation. I think something that was really impactful, though, or at least that kind of stuck with me, is just, I guess, being more specific with families when you're having these discussions, not really using acronyms, especially because I think Gwendolyn said that instead of asking them, like, oh, what are like the sensory concerns, or just kind of telling them something about like sensory concerns, you kind of just ask them, like, oh, do they like their fingernails cut? Do they take their showers on their own? Do they do this instead? Just kind of just being more specific. Um, yeah. And also motivational interviewing. I think just asking people questions and framing them in those certain ways that make them honestly want to do those things rather than kind of piling all of this information onto families and making them feel scared of these services. Rather, you make them feel like they would maybe want to do these things. But yeah.
Perfect. Thank you, Leo. It also sounds like you guys had a great conversation. Janelle, would you like me to wrap things up or would you like to?
You can just keep right on going, Tori.
Perfect. Well, thank you guys for participating in our discussion groups, as well as thank you to Janelle for her presentation. It was lovely. I definitely learned a lot, which was helpful. Our next session is going to be September 24th, and we will have Cassidy Reinhardt. I think I probably pronounced her last name wrong, so I apologize if I did. And she's going to be presenting on surviving the holidays, if that is still correct. It looks like it is. So we look forward to seeing you all there. Thank you so much for coming and participating. Bye, guys.